Greetings from the set of Metro and More at Metropolitan Community College, serving more than 50,000 students with over 120 programs at our 8 locations in the daytime, evening, weekends, or online. Hi everybody, I'm Kent Pavelka for Metro and More at MCC's South Omaha campus today with a look at the college's respiratory therapy program. We're at the Mahoney building, and with me are Jerry Moss and Tim Kelly. Jerry is the program director and RT instructor here at the respiratory therapy program, and Tim is the director of clinical education, also instructor. And guys, it's going to be a treat to be able to take a tour of what students encounter here at Metro in respiratory therapy. First, though, a little bit about yourselves, just to begin. Jerry, you've been on the show before, but I can't recall how long at the college now and then in this role?
I've been at the college here at Metro this is my 30th year actually, which is a long time. Prior to that, I worked at Emmanuel Medical Center here in the city as the director of pulmonary rehab, and prior to that was the department director at the University Hospital of South Dakota.
Very good. Tim, what's your background?
Well, I come from industry. I was in management in respiratory therapy at St. Joseph Hospital at Creighton University Medical Center. And my roots are here deep in the program. I started in the very first program that the college had.
As a student?
As a student, yes, came through the program and worked my way up to management. And then about 16 years ago, a position opened up to teach, and I gladly jumped into it. And I'm ecstatic that I'm here in the role. Because
you fiddled around with administration and you wanted to get your hands back.
Exactly.
And that's what this program is all about,
sure.
Is getting your hands on.
Hands-on,
yep.
Absolutely.
So both chime in here. Respiratory therapy as a vocation, a profession is what, and respiratory therapy in terms of being a student at Metropolitan Community College?
Well, the profession actually is being trained, we're training people to work at the bedside to take care of patients primarily with cardiac and respiratory disorders. That can involve everything from the administration of medications to various physical procedures to certainly the life support systems that are used within the critical care settings, and et cetera. The program expands then out into the home with home health care, pulmonary rehabilitation, long-term care. So there's a whole gamut that's there.
Yeah.
We got our start in the 50s with the polio epidemic, and back then we were oxygen tank jockeys, and
iron
the field
lungs.
has iron lungs, absolutely. So the field has just taken off in the last 40, 50 years, and like Jerry said, we have branches out into the home, into diagnostics in the lab, research. So our students that graduate have a great opportunity to find out what they want as they go through the clinical portion of the class and go work in the home with a patient or stay in the hospital and work with a very sick patient.
So it takes 7 quarters to get the degree, and you get the degree, what is the degree?
The associate's degree in respiratory care.
And you go in as a cohort group?
Yes.
In August of a given year, and 7 quarters later?
Students are actually accepted in June of each year, and it's a competitive, there's competition to get into the program. We accept the students in June. They begin as a cohort together in August, and then we'll continue through for 7 academic quarters as a group.
What makes respiratory therapy study at Metropolitan Community College unique and special? Because it is.
I think it's the 4 of us. There's Jerry and myself and 2 other very outstanding clinical instructors and classroom instructors. And
we should name them.
Candy Ryan and John Detweiler are the 2 other clinical instructors, and they also teach in the classroom. And I think between the 2 of them, probably 30 years of experience. So right. The combination of experience and just the love of the profession and the passion they have to do a good job when they go in clinical with the students and take care of the patient.
In clinical meaning in the hospital.
In the hospital,
yeah,
correct.
And we'll talk a little bit more about that as time allows.
I think you couple that with the support that we've received from the college too, with the facilities that we have here are absolutely outstanding. So.
Yeah, because we're going to take a look at the respiratory therapy lab. That's where we're at, but you've got a dedicated classroom, and you've also got a hospital facsimile, right?
Right, exactly.
So technology and equipment is a big issue.
Huge issue.
A distinction that Metro excels in.
Right. Right. It's a huge issue.
Yeah.
If our students aren't tech savvy when they come in, they are when they leave. It's a very technologically advanced profession.
How long does it take before a student actually gets their hands on this stuff we're about to take a look at?
The students are going to come in. Their first academic quarter is primarily in the classroom, where we're looking, beginning to prepare them for the field, looking at professional ethics, professional adjustments, and those type of things. In the second academic quarter, we move into the laboratory, where they're actually beginning to work on procedures here. So we have classroom activity, we have laboratory activity going on at the same time. In the third quarter, we begin the actual clinical practice in the hospitals.
And there's an important point to be made about clinicals in the Metropolitan Community College RT curriculum, and that is you guys are with them, right?
Right,
Exactly.
right. They're assigned to various hospitals in the city with our faculty for hands-on patient care. And we're very emphatic about the fact that it's them doing the work, not us. We're there to teach and to supervise. They're there to learn. Again,
we're in the Respiratory Therapy Laboratory. Going to let Jerry take a break. He'll join us later, and I'll be back with Tim, and we'll take a look after this break. And we are back at MCC's South Omaha campus. We are taking a look at the college's respiratory therapy program, and it's show and tell time with Tim. Tim Kelly is showing us some of the things that the students work with. And I guess maybe we should underscore that. These are just a few things.
Right, just a few of the many that we have here in the lab.
Yeah. Well, let's dig in here. I asked you earlier, what's this? You said a mannequin. I mean, so that's pretty technical. But what do we do with the mannequin? What is this?
Well,
this is like an initial.
Exactly. This is one of the
exercise?
first levels of education that our students go through. Assessing the patient, listening to lung sounds, taking heart rates in patients, and pretty simple exercises, and yet in many ways very complex when it comes to the subtle differences between the various lung sounds that we have them master. And this is a tool that we use with them to help them identify the various sounds that they hear in a patient's lungs.
Mm-hmm. You've got the dots there. What does that do?
Those are the spots that we have the students listen to over the mannequin, over themselves as they practice with each other, and then finally, eventually when they get into the clinical arena, we have them listen over these spots in real patients with our supervision, of course.
So how would show me, or can I,
Sure,
maybe you can have me do this.
Absolutely. We have a stethoscope here that's...
Just call me Dr. Pavelka.
Absolutely, Dr. Pavelka. So you would take the stethoscope in hand, and with the controller, I can program the different lung sounds that the students might hear on patients in the hospital in the different locations.
So this would be like, I'm a student, this is what a student would do, and this is how you'd be teaching
During
them?
a lab exercise, we would get the students in a group and educate them about the sounds that they might hear in a patient's lungs, and we one at a time walk the students through the different sounds that they would hear.
Yeah.
So go ahead, if you would, place your stethoscope on this green dot, and I've got it programmed, and let's see if you can identify what lung sound you might be hearing. Does that sound like a normal sort of airflow in the patient and out of?
Well, I don't know.
Okay.
How would I know?
That is a normal sound, and so then I can program the mannequin to give me what's called a wheeze. And so this lung sound would vary maybe just slightly from the sound that you just heard, but again, we have to teach the student to recognize those subtle differences in the lung sounds. And those lung sounds might be different in this part of the patient's chest from this part, and we can help the physician diagnose a patient, help the physician track the progress of patients better by knowing exactly what we're hearing in terms of lung sounds.
So how many of these different kinds of sounds is
there are about 9 or 10 different lung sounds that the students have to master.
So, and I suppose a given patient might
have 3 or 4
yeah.
all at one time. You're right.
This is not good. This patient is sick.
Yes, it is.
So this is what is that, a wheeze?
That's a wheeze, right.
Wow. Give me another one. Can you
give
me?
Absolutely.
What are we going to do here?
This is what we call a strider.
Strider?
Yeah. And each of the lung sounds that the students have to identify come with a different problem. For example, the wheeze typically comes with a patient that has asthma. This stridorous condition that you're listening to right now comes from a different problem that the patient may have.
Now, what about the heart this is respiratory therapy, but
Yes.
am I going to hear the heart too somehow?
You may have to listen to heart sounds in a patient, but typically we leave that
Something's
diagnostic
happening here, Tim. Did you push a button or?
I did not.
Like, I think this patient needs critical care.
Okay.
But yeah, oh, so, okay. So, and each one of these places is a different, gives you a different, what? On the chest.
For example, if our patient that we're listening to lung sounds on in a hospital has a pneumonia, and that pneumonia is in a specific area of the lung, we'll want to focus on that area of the lung. And so we can identify exact locations in the lung where that person has the pneumonia. That's an example.
Gives you a pretty good example of some of the things students in respiratory therapy at Metro, hands-on here at the Respiratory Lab. Now, we've got some other
And then another
toys
level of education, another level of teaching that we provide for our students. Again, in the classroom, in the laboratory settings, and then eventually in the clinical settings.
So we're moving up in terms of expertise. And,
Yeah.
Okay. This is not as simple.
Right. This is another one of the basic forms of respiratory therapy that we can provide, and it's in the form of oxygen delivery.
Okay.
And again, we're professional all about lung health and lung disease. So if our patient comes into the hospital with a sick lung, we have to make sure that the lung does its job, or as close to perfect as possible, do its job in transferring gas in and out of the body. So if our patient comes in and is having an ailment, a pulmonary ailment that makes the lung not do its job, then we have to provide supplementary oxygen.
So this
and
would be after that diagnosis?
Yes.
So
We diagnose the patient as not being able to transport oxygen across into the bloodstream. We have to provide different ways to get that oxygen in them.
Okay.
So these are tools of the trade to get patients' oxygen levels up. Starting with the simple nasal prongs, I'm sure that
seen those.
You and many others have seen this simple oxygen cannula that fits into the patient's nose. Very comfortable for the patient for the most part. When you compare this against a mask, for example, which is not too well tolerated by a patient.
Why would you use one or the other?
Well, the masks typically can deliver a little bit higher concentration of oxygen.
And what's this? What's this?
Right. This device is yet another tool that respiratory therapists would use in the hospital to help patients take deep breaths. And again, we're all about lung health in our patients that are in the hospital, and important for that patient in the hospital is taking deep breaths.
Well, this would be a way to measure how somebody's doing?
Both measure and encourage. We encourage our patients who are in the hospital, laying in bed, not taking deep breaths, to take deep breaths to aid in their pulmonary health. And they can do that themselves.
How does it work?
So we would encourage the patient we would set this device up for the patient, give them instruction about how to properly take a deep breath. You didn't know that there was a right and a wrong way to take a deep breath, did you?
No.
Right.
Maybe you can show
There
me.
is.
Do you want me to do it? Or?
Absolutely. What I'd like to have you do, Ken, is put the mouthpiece in your mouth and very slowly take a nice big deep breath in, all the way in as deeply as you possibly can.
Let me take a breath first. Okay.
And take a deep breath in slowly, all the way in, deep breath, and then hold your breath, Ken. Hold it, and then go ahead and we'll take the mouthpiece out and exhale. You did very good.
What did I do?
3,500 is what you did.
3,500 what, Tim?
Milliliters.
Of oxygen?
Of air.
Of air.
So you took 3,500 milliliters of air into your lungs, and we can use what we call a nomogram to calculate what you should do based upon your age and height, and you far exceeded what is predicted.
Perfect.
So nice job.
Perfect. Now what are
Most of our patients in the hospital don't do so well.
Yeah. So I wouldn't have to use that a lot if I was performing well.
We would, right.
Yeah.
If you did well, we would probably encourage you to use it periodically during the day. If you didn't, then we would encourage every hour.
What else do we have here? You got the mask, and then what are these? Little different color codes?
Once again, part of our work is giving patients supplemental oxygen, and these different colored adapters pertain to different amounts of oxygen that we can give our patient, and we would hook those up to the mask.
So this is a cue to a respiratory therapist who walks in the room.
A respiratory therapist, a doctor, a nurse, they can tell at a glance how much oxygen the patient's getting.
I see.
Yes.
How much time do students spend with each of these
It varies. It varies. We have a structured curriculum that guides the student through the program, and they occasionally will have 2 weeks on a set topic, and the next topic may be only 1 week or maybe 3 weeks. So it depends on the level, I guess, of knowledge that the student has to have, how much they have to practice, how much they have to. For example, as we'll get into in a little bit, the mechanical ventilation component of the program, which is a little bit more sophisticated, requires a little bit more practice from the student's perspective. We dedicated a good portion of time for that section. Oxygen therapy devices, maybe a little bit, but not nearly as much as the more intensive care to do.
This thing makes a lot of noise. We had it on earlier. What is this?
Another job, I guess you could say, of the respiratory therapist is to provide inhaled medication to patients. Again, using that patient with asthma as the example, there are different types of medications that we can put in this cup. And by turning flow of gas to this cup, the flow of gas changes this solution into a fog, a mist, and that patient would then inhale that medication and would treat their asthma condition.
It's a respiratory therapy bong, in a sense.
You said it, not me.
And it makes a lot of noise. Is this the thing that...
Yeah.
Yeah.
You can go ahead and turn that flow on.
You sure?
Counterclockwise.
Yeah,
Counterclockwise.
okay. Yeah, see, you can hear that. So...
And you can see the...
Oh yeah, the mist is coming out. Okay, we talked about the ventilator. Can we, let's take a look at that, because that's pretty cool. Absolutely. Not everybody has one, but Metropolitan Community College Respiratory Therapy Program does. We'll take a look now. Okay, Tim, before I ask you about we talk about the ventilator here, a couple things. One, you know, we've got all this equipment and stuff, but I think it's important to emphasize that in RT at Metropolitan Community College, you emphasize that these are humans, and there's relationships. I mean, you really focus and emphasize the patient part of it, don't you?
Absolutely. That's it is key in the care of our patient, that we have that empathy, that compassion for the patient. That patient who's maybe on life support and dealing with the family members who are grieving, and so it is a key component to the care of the patient, and we emphasize that. We role play with the students continually during the entire program about those kind of situations.
Is that always the case in respiratory therapy education? I mean, here it is. But
here it is.
Yeah.
I can't speak for other programs, but it is a point of emphasis with our program.
Very good. I want to make that point. Now, so this is a ventilator. Yeah, I mean, I think people think of the ventilator as the thing that's on the mouth.
It's the life support that the patient's on when they're in the intensive care unit. So this is the life support equipment that they're on. It's the plug that gets pulled, Ken, at the end of life sometimes. Wow. So it's a vital key component to intensive care of our patients.
I mean, it's a big deal that you've got this equipment here. I mean, this piece of equipment, right?
It's modern, it's high tech, and we are fortunate enough that our students can use it in lab before they go see maybe a piece of equipment. Not exactly like this,
right,
though a lot of the facilities that we go to for clinical do use this exact piece of equipment, but it's a great example of the high-tech exposure that our students get in the lab before they go to the hospital.
I was going to ask you about the difficulty of keeping up with technology in terms of equipment. I mean, is that a problem?
It used to be a problem, but our students come to us now pretty tech-savvy. So it's not the problem that it once was, I don't think.
I didn't mean personal technology. I mean,
I think there's a translation. I think there's yeah, there is. Our students are very fluent with technology in the form of handheld devices, and it translates very easily with this. Certainly we have to teach them about this specific device, but we don't seem to see the barrier that we once did. Students are very willing to come in and practice on this piece of equipment, put their hands on, and not be afraid to make a mistake in the lab.
But like a piece of equipment like this, how quickly does it become outdated?
We try to keep our equipment fairly up to date, and that requires us to maybe get a new piece of equipment every 3 to 4 years.
Yeah. Well, tell us about now. This is the ventilator, the computer part of it, right?
It's the part that we have to use on our patient to both set and monitor the parameters. In other words, if we have a patient who's sick, how many times a minute do we have to breathe for them? What's the depth of breath that we have to provide for them? How much oxygen?
How do you
What's the
determine
pressure?
that?
We can determine that on our own by watching the patient. As I mentioned before, we have to assess our patient, evaluate lung sounds. That plays a key role in determining how much the depth of breath may be set at. Some of it comes from the physician. Mm-hmm. Some of that is physician driven. They have to give us the order for certain things. In other hospitals, they have what's called a protocol, where if a patient comes in with XYZ disease, you set the patient up on these settings. Mm-hmm.
And so the lungs here are being inflated by
Yes.
which indicator here is showing us?
Those are all pictures of the same breath.
Oh.
In other words, the top picture represents the amount of pressure going into the patient. The middle one, how fast the gas is going to the patient. And then finally the bottom, what volume in terms of milliliters is going into the patient. Mm-hmm. So on you earlier, you were able to get 3,500 in. We certainly wouldn't want to give that volume of breath to you every single time. So we would set that according, again, to your height and your weight. Mm-hmm. And your age.
And so the tubes, the blue tubes here, connect to the thingamabog. What do you call this?
A breathing tube.
A breathing tube.
Technically, it's called an endotracheal tube.
Okay.
Goes into the patient's mouth and very delicately placed, not in the esophagus, which carries food down to our stomach, but rather into the trachea, the windpipe, which carries air into our lungs.
How do you can't practice this on each other in the class?
No, this is one thing that we probably wouldn't want to practice on each other.
Yeah.
Blood draws is another thing we probably wouldn't want to practice on each other. But
I'm glad we're not doing that today.
Right, we use mannequins in place of, and we use this device right here. It's called a laryngoscope, and the laryngoscope helps us guide that tube into the right place.
Let me see.
You bet.
Can I?
And
so
this is the model of what the student might see in the upper airway.
Okay, so
they can look at that, take that in their hand, and look at it and see what they would possibly see in a real patient.
So this here is giving us an opportunity to practice sticking this into there.
Yes.
Okay, so I can see that there's a couple places it could go, which,
and again,
if you guess wrong, is probably not good.
Through classroom, laboratory instruction, we educate and hopefully give the students enough time to practice to put that tube in the right place.
Show me.
Okay, so if you'd switch hands and you'd put the laryngoscope in your, and then hold it this way, good. Okay. What we're going to have you do is gently lift the tongue up and then walk it down until eventually you expose that airway in the patient. And that's how we would teach the patient with a mannequin like this.
Yeah, very good.
So again, we teach them in the classroom.
Right in there?
Yep.
How far do I go?
That's all the further
that's all
you would
need
go.
To go?
Yep. And then the tube would be advanced.
Wow. Mm-hmm. So you do, is this part of clinical work too in the hospital? Or?
It is.
Yeah.
It is. As I mentioned, we teach the student in the classroom about all the different anatomical structures that they need to be aware of in the upper airway. We teach the student in the lab about the proper procedure, and then we eventually have them go to clinical and do it on real patients, yes.
You've got adult intensive care, neonatal intensive care, and then there's a third general.
The general comes first,
Okay.
and then adult intensive care, and then finally the capstone quarter, the very last quarter, is neonatal and pediatric.
Wow.
So
Wow.
that truly is the most intensive, working with the little premature babies in the intensive care nursery who are less than 2 pounds.
You can get more information on the respiratory therapy program at Metropolitan Community College on the website mccnev.edu. And again, there's a waiting list. I mean, in essence, there's a competition to get in, right?
There is. Typically in the month of June, we accept about 70 to 80 applicants usually, and then we have to pick and choose between those, and there's a process that we use, a formula we use to pick 21 students who will enter into the program the following August.
Very good. We're at the South Omaha campus at the Mahoney Building. MCC's Respiratory Therapy Program. Jerry will rejoin us along with Tim, and we'll wrap it up right after this break. And we are back at the Respiratory Therapy Laboratory at the Mahoney Building, MCC's South Omaha campus. We've had a great tour of the Respiratory Therapy Program and Laboratory. Jerry, nice to have you back with us. Tim, maybe wrap it up by talking a little bit about what happens. I've gone through the 7 quarters. I've successfully got my degree. Now there's testing and is it certification. What is it, Jerry?
Right. The students will all be required to take a national certification exam when they graduate. Upon successful completion of that, then they're eligible for licensure in any state in the nation. And they'll have to obtain a license to practice. And then after graduation, the advanced level, or the registered respiratory therapist test, is the second test they would take. And so the program is preparing students for both exams.
Yeah. Does every student take both, or?
Every student is, we encourage certainly to take both exams within a period of time.
And you've got a great success rate on those tests.
Yeah, we're really proud of those.
Like 100%?
100% on the certification test for the last 7 years, which is very high. National average on the registry exam is somewhere around 60%, and ours is 93.
Wow.
So.
Wow. Go ahead, Tim.
One of the components of the national registry examination is a clinical simulation exercise where the student is presented 10 different scenarios with 10 different patients with 10 different diseases, and the student has to work their way through that in a clinical computerized simulation format. And our lab here has, 80 different mock simulations, so the student prior to graduation can work through those and practice.
More or less, most of them do a little better than I did on some of these drills?
I wouldn't say that at all. You did wonderful. And our application period, Kent, is next June.
So I'm just going to go straight to the test.
Yeah, okay.
All right.
Real quickly, career opportunities. Now I've taken the test, I'm certified. What's
the high percentage of the students are going to work in acute care hospitals initially. However, there's lots of other opportunities out there too. Home health care is certainly a huge one. Pulmonary rehab, long-term care, education, research. There's lots of other avenues that they can go down to. Specialization in neonatal pediatrics perhaps might be another one that would be done. Pulmonary function testing, the testing for lung diseases, all specialized areas that they can work in.
And what about the job market?
Job market's very good. We have a placement that's very close to 100% of our graduates. With the baby boomers like me getting older, that the need for these people is dramatically increasing. It's I believe it's on the rankings, it's I think the 3rd fastest growing healthcare field there is right now.
Wow.
So there is a projected need in the future too.
Very exciting. Anything you want to add, Tim, before we sign off?
Again, I've been in the profession just about as long as Jerry, and I've seen a tremendous growth in the profession, and it's neat for our students to be able to, in the clinical arena, like Jerry mentioned, to go and actually visit and see how a person is treated in the home, how a person who maybe is involved in research as a respiratory therapist. So they get the opportunity going through the program to maybe shop around to see what best fits them. So I think, again, another great selling feature for our program.
Thanks for the tour, guys.
Thank you.
Very, very enlightening. Thanks to our guests, Jerry Moss and Tim Kelly, and a glimpse of what's happening at Metropolitan Community College and the Respiratory Therapy Program. I'm Kent Pavelka for Metro and More.
This has been a MetroVision production produced by Metropolitan Community College.